All right, so thank you so much for everyone attending our webinar today. We're going to discuss how New York Presbyterian uses internal training programs to drive recruitment, retention, and revenue over the next hour. My name is Adam Binford. I am the Director of Client Development here at Vivian Health, which is a technology platform that helps connect clinicians with their next role. Today, we have over 2 million clinicians using our platform to find their next job across full-time, part-time, per diem, and travel contracts. And then with me today, I have David Crawford. David, please feel free to introduce yourself and the employer that you work for.
Sure, Adam. Well, hello, everybody. I'm David Crawford, Vice President of Talent Acquisition at New-York-Presbyterian Hospital. New-York-Presbyterian is one of the most comprehensive integrated academic healthcare systems, treating patients in the New York metropolitan area, which is where we're based nationally, and then also worldwide. For those who don't know, we are partnering with our two medical schools, Weill Cornell Medicine and Columbia University Vangelis College of Physicians and Surgeons. Recognized leaders in innovative healthcare. As an employer, though, aside from us being a healthcare system, we've been recognized by Forbes as one of the America's large best employers. Again, most recently for best employer for employers for women in 2024, 7th year certified as a great place to work. And 7 of our hospitals currently hold magnet recognition. For me, myself, I've been here for over 8.5 years looking at recruiting for our all of our hospitals, our medical systems, our medical groups. That's for both union, non-union jobs, everything as it relates to hiring folks here at New York Presbyterian, including both internal and external hires. So that's a little bit about me.
Awesome. Thanks so much, David. So for the agenda today, this is going to be an interactive discussion, so please feel free to submit any questions in the chat bot at the bottom. We'll try to cover them either throughout the presentation, or we'll also have time at the end to kind of answer any questions. But in terms of the agenda today, I am going to share some highlights from our 2024 healthcare workforce survey. And then secondly, turn it over to more an interactive discussion with David to talk through New York Presbyterian's talent acquisition strategy, some of their innovative recruitment techniques, and then also retention strategies as well. So to start with the highlights from the 2024 Healthcare Workforce Report, this is an annual survey that we do to the clinicians in our talent pool. We recently surveyed candidates and had about 1,000 respondents, and I'm going to share a couple slides on some of their answers. So starting with mental health, candidates are asking employers for more mental health resources and support. We did find from the survey that 46% of respondents did state that they were experiencing clinical depression last year. And of that, around 29% did visit a mental health professional last year as well. Following that, burnout risk is still deeply affecting the candidates. 72% of respondents stated that burnout is the same as last year, and about 42% are still considering leaving healthcare due to some of the burnout challenges and risks. The respondents did state some of the employer responses to this is offering more flexible work schedules, offering more wellness programs, and then lastly, increased pay. Finally, in terms of candidate priorities, we did survey candidates and asked for those clinicians who are looking for new roles, what are the top reasons that they are looking to change? Pay is still number one. Following that is work-life balance, adequate staffing, schedule flexibility, and location. It's important to note that work-life balance and adequate staffing continues to rise in importance, while benefits is no longer in the top 5. So wanted to share a bit of that information. At this point, though, I will turn it back over to David. Welcome again. I'll kind of stop sharing the slideshow so we can have this more interactive discussion. David, I know some of that information, obviously less pessimistic, but would you mind sharing what challenges you're facing in terms of nurse recruitment and retention at New York Presbyterian?
Sure. Well, it's not a surprise when people are talking about burnout, especially during the height of COVID. And now that we have, moved away from that, what is that really saying? The data that we have is talking about adequate staffing. And by that, especially for our nurses, that means having the other roles around nurses to help them to work at the top of their license. What are some of those other roles that are really important? It means having nurse aides there to perform functions. It means as patients are here and they need diagnostic tests for radiology or ultrasound or MRI, it means making sure that lab technicians are here or lab technologists for lab tests that need to be performed. 99% of the people who come to New York Presbyterian need a lab test. It means transporters. It means having the rooms cleaned. So the idea is, what can we do to enhance the experience of the patient while they're there, so to alleviate some of the pressure that our nurses are facing. So that's one. I think the other thing is that you referenced there was compensation. We try to be as competitive as possible, as we can. So we do have salary reviews. But really what this means when we're talking about burnout is, do I have enough staff so that I'm not overworked, so that I'm not tired, that I can perform my function in order to focus on the patients that we do have?
That's great, David. Thank you. And then in terms of, could you share a bit more about your strategy to tackle these challenges in terms of, your core values and the culture that you are, instilling at New York Presbyterian?
Yeah, when companies talk about culture, it makes me think it's great to have the placards up and the postcards and all of that stuff that's there when it's good. An organization is truly tested when there's a jolt to it, when it's not so easy. If a culture is strong, that actually helps to pull an organization together. When it's not, it moves apart. When we talk about our culture, we basically articulated 5 values that are really important to us, and we want to make sure that we're constantly talking about them. The 5 are teamwork, integrity, innovation, empathy, and the foundation is on respect. Respect for one another, respect for the colleagues, respect for our patients. So that's what's important. And as we, talk about that, and it's not just words on a page, we have infused that into our performance system. We train managers and individual contributors about what that means when you're talking about teamwork, when you're talking about empathy. So those values are really very important. Now, let me shift for a second over to the business side. So we're going to pull up a slide, which is what we have for our strategy that speaks about us as an enterprise. You'll see at the very top, it talks about creating a healthier future for all. What we are striving for is to be the best in tertiary and quaternary care, accelerated by research, education, and empathy. What does that mean in plain English? Tertiary care is for specialized care, such as an organ donation, a heart transplant. Quaternary care is about the advanced level of that specialized care. We had one particular situation at our children's hospital where an infant received a heart for a heart transplant. That heart then that was no longer going to be used by that infant was used for another child because the valves were intact and were healthy. So that particular situation benefited 2 babies. And that's what we're talking about, something that's more cutting edge. That was the domino transplant, as we referred to that. So back to the slide. What we want to do is lead in quality, experience, and outcomes, patient satisfaction scores. The Joint Commission was in recently for the triannual survey where we performed very well. Providing seamless access. When you're sick, when you need to see someone, how do you make an appointment? How do you get to us? Which then serves to seeing more patients. And then it gets to that piece about advancing our world-class talent and culture, why we are here, what that means as far as pulling us together so we can take care of our patients. The foundation that this is on is health justice, dealing with health disparities. There's a report that's out there that was looking at, health inequities that are out there, in some cases, death by zip code. What can we do to make sure that people get care while they're still healthy? Digital and tech transformation. What technologies can we have out there to make sure that we are the most efficient that we can be, and learning more about the marketplace that's out there? We have one electronic reporting system, which is Epic, and then it comes down to operating efficiency. So with that, how can we streamline? How can we be more effective across the 40,000 employees that we have here at New York Presbyterian? That's where we are. So that's what we need to be focused on to remind us about what we do every day that we're there to care for our patients.
That's really helpful, David. A question did come in. Please let me know if you'd like to answer this now or wait till later. But the question is, how does New York Presbyterian navigate creative nurse scheduling post-COVID-19, where work-life balance takes a center stage?
I'm really glad that we received that question. The way that I answer this is, everyone was talking about the Great Resignation. I don't see it that way. I see it as the Great Reflection, and let me explain what I mean by that. Now, during that time, that's when everything stopped. And by that, I mean the social events that you were attending, the sporting events for your kids, sometimes even schools where kids were educated at home. You couldn't go to a sporting event. With that, all of the noise that was out there stopped. And you had the time to be at home to figure out what was really important in your lives. That's when people made some decisions. Do I want to move? Do I want to be in this type of job? What do I want to do with my life? In some cases, relationships fell apart. In other cases, relationships were strengthened. It was a time to think. Now, in healthcare, the majority of our staff didn't have the time to stay at home. We had to be here during COVID to take care of our patients. And that was an incredibly hectic time. And I'm thinking about before the vaccines were even available. We had to act on that immediately. And what were we going to do? Now, post-COVID, well, not post, but farther along because COVID's still around. Where are we? Well, this means that flexibility needs to be there. And that means as far as who do we have on site? What do we do about flexible scheduling? What do we do about people who are out on leave? And that's where it's more of a decentralized process. We have to have policies, procedures, and guidelines in place, but we're more sensitive to the fact that we need to think about what this means coming through this great reflection. So hopefully I've answered that question to the person who asked.
Yeah, thank you so much. So David, just switching a little bit more toward like internal mobility, can you talk a bit more about, internal mobility programs that you have at New York Presbyterian, some of the career pathways that you have for your employees?
Well, I'm probably talking now to the people who work in talent acquisition who receive hundreds, sometimes thousands of resumes that come through. In many cases, there are a number of people who apply to not just one job, but to several. And in many cases, it's just spaghetti against the wall. Where people have that as a strategy. I'm looking to find a job. Probably my best hit is I'll apply to more jobs. Well, as a recruiter, we have to make sure that the people who are applying to those positions are qualified, or at least they have the transferable skills to move into those particular jobs. We've made it easier at New York Presbyterian for people to identify the type of hot jobs, the skills that are required, where those jobs will be there for the next several years. And that comes down to the types of jobs that impact how we take care of our patients. For example, we need lab techs. How do we put people into programs where we can get more people into those particular areas? For the operating room, central sterile, who cleans the devices, CRNAs, PAs. When the idea behind that is to make sure that we tell people about the jobs that are important and then to offer training, education, in order for people to move into those particular disciplines. And that piece has become more critical. Tuition reimbursement isn't necessarily about receiving an advanced degree, but we wanted to include certificate programs as well. People who need to be registered, having the wraparound training that's there. And also we take this idea about how to develop your career. How do you think about your career development on the road? Locally at our hospitals, we often host open sessions to talk about career pathing and having executives talk about what they do, and also individual contributors, how they've navigated to these new roles within the organization. It all comes down to communication. And that's where we think that there is a difference in making people more thoughtful and having a strategy about moving into particular roles.
It's really helpful. David, we have two questions come in. Just give me a moment to kind of look and see which. We'll be switching gears more towards some of the changes I think that you made to the talent acquisition team in terms of sourcing and automation, but this question kind of might go into that. Suggestions on when you receive, less than, let's say, 5 qualified applicants for a position. Kind of what you're doing when it seems like the application volume per position is a bit low.
Yeah, and there will be. I mean, think of the particular market where I am. I'm in New York City. And with that, there are many good hospitals in New York City. As a matter of fact, for one of our locations, you can walk across the street to work at another healthcare system. So our brand is very important. What it's like to work here is very important, but there will be roles where it's very competitive and we need to find more applicants. It's kind of moving away from the post and pray that someone applies to the post and pray, go out and find people. To make sure that we are very visible, that people are thinking about us as a top employer. We do have a sourcing team who actively look into our database to find folks who maybe didn't get selected, but they're terrific candidates. And what do we do about being proactive to tell them about a new opening? Also, we have to be very present and on the road and visible, going to schools, going to professional associations, talking to community-based organizations about the roles that we have and getting us to meet people in person so that we can route them appropriately. But we can't give up. So even if we don't have a strong pipeline, we have to come up with a strategy to get noticed by folks who might not be thinking about, looking at another place to work.
Makes sense. On that same subject, David, if you can elaborate more to some of these changes, like I believe the increase in your sourcing team, and then also some of the on-site interviews that you've done as well in terms of full talent acquisition.
I did mention the sourcing team, and we've all seen the products that are out there that focus on artificial intelligence. So using various tools that can prioritize candidates for you, be it internal or external, read the resume, compare it to the job description. It's all important stuff. And I'm not trying to dismiss that in any way. But I'm a recruiter, have been doing that for a long time. You cannot negate the human element about what we do. And just think of it this way. There might be some situations where you as a consumer don't mind when you call in, push number 2 for this or number 3 for that, or getting information that is available based on a chat and questions that you may ask, and then you're satisfied with that. But there are situations when you just want to talk to somebody. And what I also remind the recruiters of my team and the sourcers is that in a hiring decision, there are 2 decisions to be made. One is, do I want to hire you as an employee? The other is, do you want to be hired? As people are gathering information, we want people to get to know us before they even get to the interview process. So that's why we have had a number of informal, professional lunch and learns, getting to know people and giving them the opportunity to ask us questions before we're asking them questions. We've also looked at ways that we want to streamline our process. In the olden days of recruiting, you used to have candidates fill out these lengthy applications, asking about the school and where they've lived and basically putting their resume back into the system. It doesn't make sense. I want to make it as easy as possible for someone who thinks, might be interesting. Why don't I submit my LinkedIn profile, my resume, have them check me out before we even move forward with that. And that's another thing that we're definitely doing. So this idea of getting to know folks is really important earlier in the process rather than going through the vetting of an interview process. So hopefully that helps.
Yes, thank you. Question came in that has some relevance here. How long is the time turnaround for an applicant to get an update on their initial job application? Do you have any SLAs?
Yeah, there are a number of applicant tracking systems that are out there that are used so that you don't necessarily have to receive an email. But you go onto the portal and you can see what your status is. who checks the status? People don't all of a sudden, do that. But this is the way that it works ideally, and this is what we do have. So once a person applies online and submits the resume, in some cases answers a few questions, confirming some information about their experience, they receive an automated email that goes out just to confirm that it made it into the system. That gets rid of the question of, did they even get it? Do I even know that it's there? It shows up on the recruiter's dashboard, so you can see everyone who applied. Now, the biggest misconception that's out there is everyone thinks for these applicant tracking systems that it's a black hole. I submitted my resume and no one knows what's going on with it. The truth of the matter is it's not a black hole, it's a black box. I can see it. We see everything that's here. I know if you apply to 20 different jobs, I know that you've applied to jobs over the last 3 months or 3 years. We see everything that's there. I can even see if you switched out your resume as you've been applying. What we need to do on this side is make sure that we have effective screening and contact with folks. We'll change your status in the system. And in some cases, we're following up and we're sending you emails. And we'll tell you that we're just turning you down if we're not advancing. But if we are scheduling for an interview, that's when a conversation will take place. And with that, I want to make sure that we are talking to all of our candidates about if they're not advancing. We gave you the time to interview with us either over the phone or either through a Zoom or something like this, or you came in person. I owe it to you to tell you if we're turning you down or give you some type of feedback. So with that, what's the expectation? We're only going to keep jobs up probably about 3 weeks or so that we're not collecting them for a longer period of time. And then as we're going through the process, we'll communicate and we'll let you know what's going on with that. But for recruiters, my recommendation is don't keep a job open for several months because it's not productive and it just infuriates candidates. So hopefully that helps.
Yeah, absolutely. Thank you. So moving back to, again, some of the changes that you adopted with the sourcing team and such for talent acquisition, can you talk through some of the outcomes that you've had? I think sharing some of the Saratoga benchmarks would be helpful here.
Well, part of that had to do with we refer to it as a waste walk. And that's when we were looking at our standard operating procedures, and there are some things that are just not efficient. And what I wanted people to do was to think about how we've done things historically and don't say that's just always the best way to do it. What can we do to remove barriers, to use technology in a smarter way, to make sure that we're not wasting our time or money? So working with our finance team, the folks who have the Six Sigma black belts, using them as folks from the outside to look at it from a fresh perspective about what can we do to streamline and make our processes more efficient. So that's there in order to get to the point of our benchmarks. We do follow and adhere to the Saratoga benchmark. Saratoga is the PwC product that basically says how many days does it take to fill a particular position? How long should that take? So with that, we monitor those on a monthly basis to see where we are, because we do report that information to our trustees to let them know how we're doing. Now, it's very different if you're looking for certain jobs that are easier to fill, and there are others where the process is just going to be lengthy. For example, the credentialing process for advanced practice providers. Think PAs, CRNAs, NPs. What do we need to do to streamline that particular process? That's really important. So it's a combination of looking at what our processes are, making them more efficient, and then making sure that we're communicating effectively what the timeline is for candidates out there. But you got to have goals. If you don't have goals, you don't know what you can achieve.
Thank you. So switching over a bit to diversity and inclusion. So can you talk about how New York Presbyterian ensures a diverse and inclusive hiring process?
Well, when people are talking about diversity and inclusion, and most recently, politically, when people are talking about DEI hires and, what does that mean? I always stop folks for the time being. And especially if I'm from an audience, I say anyone who, I'm going to list some professions out there. And if you not worked with one of these professions, raise your hand. Has anyone worked with an accountant? Has anyone worked with a lawyer? Has anyone retained a plumber or an electrician? How about a doctor? Everyone has needed the services of a doctor, and the patient population is diverse. So because of that we all need healthcare, we have to make sure that we have folks who represent our markets, our patient populations, the societies where we are. Because no matter what your background is, if you come to New York Presbyterian as a patient, you feel more comfortable seeing that there's a diverse staff. You see more comfortable knowing that this diverse staff is a team and they're all thinking about you, the patient. So that's what's important to us. We've also learned by having an inclusive, point of view, is that something came to our attention a number of years ago with the forms that we use when babies are born, listing who the mother and the father is. And that's on the form, mother, father. Well, what we found is that there was a particular situation where there were two mothers. There was no father in that particular situation. So with that, we made a decision to change our form to parent 1 and parent 2. So being sensitive to the needs of our patients and accomplishing our goals of what we were looking to do, it kind of opened us up to how we can not only treat our patients, but make them feel accepted and that they belong here. So that's what I have to say about that, about diversity and inclusion and why it's so important.
Thank you, David. So just, I guess, shifting back to talent acquisition and recruitment campaigns, can you share some examples of successful recruitment campaigns that have worked for New York Presbyterian?
Well, it's not unique to New York Presbyterian, especially when I was working in financial services or money center locations. There's some things that are on job descriptions that just don't make any sense. 5 years of experience in this or 7 years in that. What does that mean? The fact that you've been in a job for that long doesn't mean that you're making demonstrable changes or improvements in what you've done. So it comes down to what are the skills and the competencies and where do you have evidence of making change, of learning, of driving things forward with the strategy. In some cases, it's just a default to have bachelor's degree requirement. I'm not saying that about BSNs, Bachelor of Science of Nursing, so don't think I'm saying that at all. But for some positions, it might mean you don't need a bachelor degree in order to perform that particular function. So by looking at our job descriptions and giving more thought to that is really important. Now, I have a prediction that you will start seeing more job descriptions in the future relaxing the bachelor degree requirement. Think of it this way, with the cost of a college education, even just for not the 4 years, but for the first and the second, it's incredibly expensive. People are being saddled with debt, especially if they're receiving or paying for the brunt of that. The idea behind that is you're going to start seeing fewer people pursuing these college degrees. If you had an English degree, an art history degree, even an economics degree, which is what I have, it's going to start going away. People are going to start questioning the value of the college degree. So with that, I think for a number of positions, we need to pull that back a bit to find out what's really important for the person to perform that job. I get it if a registration is required. I understand it if it's for magnet. I understand when you need a particular license, but not every job requires that.
That's helpful. That's very insightful. I'm sure a lot of parents might be happy to hear that as well as they're thinking about sending their kids to school and looking at the career path in there. So talking about nurse retention strategies, David, can you give us an overview of a few of your nurse retention strategies at NYP?
I think it really comes down to people will tell you what they're looking for. So when the idea is, well, how to retain folks? Is it about having cookies and balloons and tickets to a ball game? People want to be heard. So with that, we happen to have a number of pulse surveys or our annual employee engagement surveys, where we're asking, what do you need? What makes you belong? What do you need to tell folks? And usually it comes down to do you have the tools necessary to perform that function? So by having that question that's out there, they'll tell you what they need. And I think it really comes down to that listening piece. So retention is asking people and being an active listener. The other piece is about treating people with respect. That also means saying thank you to folks and acknowledging the work that they're doing. For our nursing areas, we have what we refer to as our 4 committees. The 4 R's are recruitment, retention, recognition, and respect. That's not just leadership getting together with these committees. It's the individual contributors. It's supervisors and managers and patient care directors who are getting together to think about these things, about what the staff need. That's at our different campuses, so it's not as if there's just one, because what you might find at Queens is different from Brooklyn, which is different from Washington Heights. And with that, we want to make sure that people are aware of those 4 things that are meaningful. Now, as it relates to, I guess we could go down that path about how do we measure the effectiveness of the things that we've been doing, since I spoke about that before. In 2022, we had an overall vacancy rate of, I'll just call it around 8%, something like that. That's 2022. That was during during COVID, the height of COVID. In 2024, where we are right now, it's less than 4%. It's 3.7. That slight difference as far as vacancies, we went from what used to be pre-pandemic 1,500 jobs to 3,000 jobs. That's a lot. And now we're down to where we were as far as vacancies at a pre-pandemic level. Attrition. You referenced burnout and what was going on. During 2022, our attrition rate for nurses was around 35%. Last year, it was 17%. And this year, we're trending less than 12%. So once people feel that there are enough staff, it just makes it so much easier to be engaged, energized, and focused on what the job is. So those are some statistics that I'm very proud of that we happen to have here at New York Presbyterian, which makes this a pretty special place.
Yeah, it's wonderful. Congratulations. Thank you. David, really, thanks for the time. So in the end, what are your top 3 tips that you would like to share with the audience today?
Well, it kind of reinforces, what I was talking about before. And when you're looking at hiring, when you're looking about retention, remember the Bureau of Labor Statistics projects that the U.S. will face a shortage of about 200,000 nurses by 2031. So the idea is retain the ones you have and see who you can cultivate and develop. I have 3 simple things that anyone can follow. Number 1 is have a listening strategy. Have town halls. Talk about the business strategy, but then also spend a lot of time, the majority of time, talking to the audience, saying, what questions do you have? What issues do you want to raise? It also means not just at a major town hall, but smaller sessions. Leaders need to round. They need to be in settings that are more intimate, where you have the opportunity to see people in their environment, talk to them about what they're doing, ask them what they're doing, and they will give you very good suggestions that will make sense. And in many cases, you're just removing the roadblocks that are preventing them from achieving what they're really looking for. Active listening. And the reason why I'm saying listening is important, how many people like to express themselves through Instagram, TikTok? People don't have a problem expressing what their views are or what's important to them. So listening. Number 2, once you've heard it, now act on it. Do something about it. Otherwise, it will just disappear. And people will think you're not really interested or care about what they have to say if they've told you and you do nothing about it. The last thing is, so of these 3 points, it has to do with empathy. Now, where I've worked before in other industries, this has a particular meaning, and it's very special to me about being in healthcare. I often say to folks on my team, it's not like this is Disney. People aren't excited and looking for, this is what I want to do. People are going to a hospital because they are vulnerable. They're sick. They're having a baby. They want to be protected. They want to feel safe. They want to feel that they're getting expert care. If that's the situation, show them that you care. Show them that you want to make sure that they get better, that we're there as people to help in that particular situation. It's not about the technology. The technology helps us with our jobs, but let's be real. Siri is no one's best friend. It's the connection that you have with people. So listen, act, and care. Those are the three things that I think any particular company can incorporate.
I love it. Thank you, David. I did receive a question in the bot, but I like to hold this for the Q&A. So I will now kind of just transfer over, provide a brief overview on Vivian Health for 3 to 5 minutes, and then we'll move to a Q&A. So please, anyone that has questions, please feel free to put them in the chat bot and we'll answer them here momentarily. Just slideshow here. Okay. So very briefly, just for those that are not aware, I want to talk a little bit about Vivian Health for a few moments. So Vivian Health is the largest and fastest growing clinical marketplace. We are owned by IAC. I mention this because the brands under the IAC umbrella are all going to be marketplace sort of technology. Care.com, Angie's List, Match.com. A lot of people refer to us as the Match.com for healthcare positions. The way that the platform works is candidates, clinicians across nursing, allied health, advanced practice, sign up on our app, either through the Android store, iPhone store, or on a web-based browser. They upload or update their search preferences, whether they're looking for a full-time position, part-time position, a per diem travel contract. They then upload and create a universal profile, which is a combination of their licenses, certifications, work history. Once they have this information intact, they will start to receive job alerts directly to their phone based on roles that match their profile and their search activity. So on the right-hand side here, you can see jobs that are posted to Vivian. Currently today, we're working with over 90 different employers across health systems and non-acute providers, as well as a large amount of staffing agencies who are using our platform. We do standardize job postings on the platform to a specialty discipline, location. There is pay transparency on the platform, shift, hours, etc. Again, we are going to take this standardized data and from there push jobs directly to candidates. So the goal being a better experience for clinicians on the platform. They are no longer having to go to individual career sites or job boards, but receive job alerts directly to their phone. And then for the recruiters and sourcers, any candidate that clicks and applies to your role will be vetted based on a number of automated questions. Across the Vivian talent pool, we do have about 2 million clinicians that are using Vivian today. We have around 2,000 plus daily signups, and this is going to be across, again, nursing, allied health, which includes respiratory therapists, phlebotomists, social workers, techs, even therapy, PTs, STs, OTs, and advanced practice as well. Last slide I'll have here is the total clinicians on Vivian. So we were founded again around 5 years ago. It took us around 5 years to reach 1 million clinicians on Vivian using our platform to find their next role. We've since doubled that number in the last year. So word of mouth has gotten out. We have given it, candidates a good experience on Vivian, and now they are coming pretty exponentially to the platform to find their next position. So that is the end of the slide deck. Please, again, anyone feel free to place some questions in the chat bot. I've got a couple that come in here. Let me just take a moment here, David.
There's one that I see there right now, Adam, that was one of the earlier ones that we can continue, which was, how do you see the contract workforce challenges as compared to full-time roles and benefits? We do have a need for contract workers. So for example, we might have situations where someone's out on a leave. All right, so you're not going to hire an employee to backfill because the budget's not there for that. So you'll always need, especially in seasonal times, some contract workers. We partner with vendors who bring temporary workers to us. But the focus and the attention is not to have this balloon of contract workers. The idea is to have employees here who understand and fully appreciate the culture of this place, who fit into our environment about that, to understand what it means to I guess go above and beyond for our patients, and to have that sense of empathy, and at the same time work respectfully with our colleagues. So do we need contract workers? Yes, but the focus has to be in bringing on board people into full-time, part-time, and per diem positions. That made a huge difference as we shifted from the height of COVID, where we had a lot of temporary workers here, over to employees. And that piece about internal mobility and career development is so important. If you fit into the culture, I can teach you another skill. I can teach you another job that you have here. I can't teach you empathy. You either have it or you don't. So I just wanted to comment on that particular question.
Yeah, thank you. I can cover one briefly here. Someone had asked just the top 5 job seeker priorities. Again, this information is taken from our annual survey. Most recently, it was about 1,000 clinicians that we did survey. It was ranked in order from pay, work-life balance, adequate staffing, schedule flexibility, and then finally, location. Additionally, we'll be sending this reporting out, and you'll have the slide deck available as well.
Let me add something else to that, because I don't think pay is the top. I think it's one of them, but it's not. I think that the corporate culture is really important. Now, from a recruiter standpoint, and there's some research that's out there, the company that has the best shot of hiring, especially in a very short market, is it going to be the brand of the company? Is it going to be the pay that's offered? Or is it going to be the speed as far as going through getting an offer? The answer is speed. So that's what we try to do here. Not in all instances, but for the majority of them. We want to find that we connect with people a lot sooner and give them the information that they need so that we can close out the position. There's another question that's in here about what tools are there that we utilize. I think there are a few. One, as far as being very basic, is you need an applicant tracking system. If you don't have one, that's something that you definitely need. There are probably smaller organizations that have Excel or whatever. And the one that we have right now, I mean, our main platform is Workday. But regardless, you need an applicant tracking system. The other thing that we've incorporated are video interviews. I have to tell you, a decade ago, there's no way I would participate with me being as a candidate on a video interview. Well, these days, I mean, between Teams and Zoom and everything else that's out there, people feel more comfortable doing it this way. It's not so awkward. So we do have live interviews that are set up through a piece of technology, and also recorded. We happen to use HireView, which used to be a Modern Hire. The other thing that's important as far as a recruiting tool is you have to have a company website that is engaging, that's interesting. We have videos that show up on ours that highlight various folks across our campuses and many different types of jobs. They're about 90 seconds or so. But with all of them, I wanted 3 things to happen in these videos. Number one is it's focused on our patients, so that no matter what role you have, you know that you are contributing to delivering expert care to our patients. Number 2 comes down to pride in the organization. You can tell if someone's faking it, but you have to show that I'm proud to work here with what I do every day. And the last thing is about who the people are. You have to like them. In 90 seconds or less, you have to like these folks that you'll go and watch another video. It just shows the character of the people that we have. So I would just say that those are some things that you need to think about as far as tools in order to engage in the market.
That's helpful.
There's a question there about someone who's a volunteer. I'm thrilled that we have one of our volunteers here. Being hired to the company, apply to a job. We post them on our website. You can see what they are, and you have actually an insider view that you know who some of these folks can be. And so with that, I would encourage you to apply online for the positions that we do have. Go to our public website. You can see that stuff there, and go ahead and apply.
Fantastic. David, any closing comments before we end the session?
I'd have to say that, well, first of all, thank you very much for including me here. I'm glad that I had the opportunity to speak about, I'm proud of the work that we do here at New York Presbyterian, from not just the patient care, but then also my team. We've been recognized for a number of years. I think this is our 8th year that we're going into the Candidate Experience Awards and, showing up as winners there. And what everyone really needs to understand, and the recruiters do on my team, that one hire that you're making to put into that particular job is going to join a team of folks who are going to take care of patients. And that benefit, that ripple effect, you will probably never know about or fully appreciate. But the work that we are doing here will impact not only the patient, but the family and friends surrounding that individual. A number of people on my team, they've had family members, they've been patients themselves. So they really understand and appreciate what they're doing and why they're doing it. When I used to work on Wall Street a number of years ago, great organizations, I loved it. In many cases, it felt like what we were working on was so critical. It was life and death in order to get something done. The reality is, none of it was. The truth of someone working in healthcare, it is. And that's why the seriousness of what we do, you can get lost in the metrics and the process and what's going on and the benchmarks that are out there. But you can never forget the important work that you are doing to benefit someone in ways that are just fantastic. So that's what I'd have to say.
Thank you, David. Yeah, thank you so much for being here. As an ex-New Yorker, thank you so much for being here. And for someone that has had family in your hospitals as well and had a very pleasant experience, thank you so much. I hope everybody enjoyed this. Again, you'll be receiving an email with the slide deck and video from today. And if there's any additional questions, please feel free to reach out to us. But thank you all, and thank you, David.
Thanks, Adam.